No, we are doing the Fiqh of fasting presentation today, and our presenter today is Shaykh Dr. Rafaqat Rashid. This presentation is specifically for people who are presenting the Healthy Ramadan and Ramadan Initiative talks. Inshallah, I will be joining you within next 2 minutes. We're just waiting for our presenter to come through, inshallah. So if you can bear with us for another 2 minutes, we'll inshallah be live again. بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. Jazakallahu khair, everybody, for joining us live on this Sunday morning, a beautiful morning, and you decided to commit this time to listen to Fiqh of Fasting. So I'm really grateful for you to join in live for this BIMA's presentation. We'll be shortly joined in by Shaykh Dr. Rafaqat Rashid, who will be presenting the talk. I am Dr. Rashid Latif. I'm a GP based in Nottingham. I'm also the lead for BIMA Health Promotion Talks 2018. Inshallah, we'll be starting shortly. Sister Hafsa Qureshi, who's member of BIMA Council and also a coordinator of BIMA regions, is going to, inshallah, start the talk by giving a brief intro to BIMA. So, Sister Hafsa, it's on to you.
Assalamu alaikum, everybody. Jazakallah khair, like Brother Rashid said, for joining this morning. So I'll keep this brief. We just wanted to give a brief introduction to BIMA for those who are new to BIMA. Could you change the slide, Brother Rashid? So I'll just briefly be telling you about who we are, our mission and vision, what we do, and how to get involved. Next slide, please. So, alhamdulillah, so the British Islamic Medical Association, we're a relatively new organization, founded in 2013, and we're for all healthcare professionals in the UK. What makes us different is that we're guided by Islamic values, and we're a grassroots organization with representation, mashallah, in all regions of the UK. And we have an elected, accountable leadership, and it's for BIMA is for all healthcare professionals, regardless of ethnicity, grade, specialty, or country of qualification. And basically, what we want to do is we want to unite, inspire, and serve all the Muslim healthcare professionals in the UK, as well as serve the community. So there's our mission statement: inspiring our members to unite in the service of our patients and profession. The theory being that, inshallah, if we're united, we can achieve a lot more than what we can do as individuals in our own hospitals. And in our own localities coming together. I mean, this health promotion is an example of that, mashallah. We have hopefully this talk happening in multiple centers across the UK, inshallah, which is, inshallah, is an amazing thing that can only happen from us all coming together, inshallah, and being united. I mean, our aims are, we have 6 aims. to promote better understanding and appreciation of principles of and values of Islam amongst all healthcare professionals, to protect and promote the health of patients and the public by adhering to the fundamentals of Islamic ethics and good medical practice, to encourage professional and social interaction amongst Muslim healthcare professionals and the wider medical community in the UK, to promote research and education in the field of medicine, Islamic medical history, and Islamic medical ethics, to engage our professional skills in charitable activities locally and globally, to help the needy irrespective of color, creed, or faith, and to advise and support Muslim healthcare professionals and students in career development, orientation, and other work-related issues. Next slide. So that those somewhat wordy aims, you could argue, boils down to our work being in 6 areas. So we do community service. So this health promotion is an example of that, as well as you may have heard of the Bima Lifesavers project. Last year we had, mashallah, 17 masajid participating in teaching basic life support to over 3,000 people in one day, mashallah. So that's one of the things we do. Trainees and students, for example, every year we have an F1 induction course. We've been running that for about 5 years now, mashallah. Advocacy, so we have been, for example, one of the areas of our work is the Bare Below Elbows and Hijab project, where we have been we've made toolkits on how women who are being challenged in the workplace over their dress code, how they can, be proactive about this and make changes in their workplace. And we've also done research in this area, and inshallah, hopefully we'll be having a publication in the BMJ soon in this area of dress codes. Islamic medical history and ethics is the 4th area of our work. So we've produced exhibitions on Islamic medical history and ethics. We've also, producing leaflets on, ethical issues. We've had organ donation seminars on the issue of organ donation, for example. Events, for example, last year we had our first national conference attended by over 250 people. We've had 3 women's conferences now, mashallah, every 2 years. And we do various events throughout the country as well, and professional development. So we run various webinars and have had leadership courses, for example. So the scope of our work is quite broad, alhamdulillah. And next slide, please. So, do get involved. Alhamdulillah, we already have over 1,300 members. It's very easy to sign up. It's completely free as well to sign up. You just have to go on our website, www.britishima.org, and just sign up. It takes about 30 seconds to sign up. We're also on social media, Facebook, Twitter. And a lot of our interaction happens over WhatsApp groups. So if you sign up, you can have the choice of joining your regional WhatsApp group, or also we have interest-based WhatsApp groups. For example, we have a Bima GP network WhatsApp group. So any information, if you have any queries about Bima's work, you can always email us in info@britishima.org to ask any questions, or just sign up and get involved. And they've got strong regional networks as well to get to know people in your locality as well. So any questions about Bima, I'm happy to take, or I'll pass it back to Brother Rashid for now.
Okay, Jazakallah khair, Sister Hafsa, for that very slick introduction to Bima. Inshallah, what we'll do is we'll take your written questions, so you can post your questions as the talk goes along. Shaykh Dr. Rafaqat Rashid has kindly joined us now live. So those of you who don't know Dr. Shaykh Rafaqat, he's a traditional Muslim scholar. He's a GP working in Bradford. He's a professional trainer and educator. He's a co-founder of Al-Balagh Academy and course director of many of its courses, especially the famous medical fiqh course, fiqh of medicine course. And I'm also honored to be enrolled as a student of this course, alhamdulillah. So he's one of the senior lecturers at the JKN Institute. He's the main teacher of Arabic grammar, and he's known for his extraordinary way of teaching Arabic grammar, and it attracts students from various towns across the country. He's also staff writer for Al Mu'min magazine. He's written for articles like Ask a Muslim Doctor, Living Islam in Modern Times. He's an academic in the field of Islamic medical ethics and medical law, having obtained his master's from the University of Manchester on the subject of Muslim scholarly debates on the issue of organ transplantation. And he's also got the title of honorary lecturer and at the University of Leeds. So I'll be passing the controls to Sheikh Dr. Rafaqat. Now, if you can just bear with me, I'm just new to this webinar thing, inshallah. Right. So over to you, Sheikh Rafaqat. Jazakallahu khair for joining us.
Assalamu alaikum wa rahmatullah. Can you hear me?
Wa alaikum assalam wa rahmatullahi wa barakatuh. Loud and clear.
Okay. So I'm ready to begin as soon as you allow me to begin.
Sheikh Rafaqat, you're all ready to go, inshallah.
Jazakumullah khair. Bismillah ar-Rahman ar-Rahim. Alhamdulillah. Alhamdulillah nasta'inuhu wa nastaghfiruhu wa na'udhu billahi min shururi anfusina. من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله ونشهد أن سيدنا مولانا محمدا عبده ورسوله صلى الله تعالى آله وأصحابه وسلم تسليما كثيرا كثيرا وبعد السلام عليكم ورحمة الله وبركاته. Now I've been given the topic of fiqh for doctors and allied professionals in relation to Ramadan. And within this particular subject area, there is a hell of a lot of fiqh. And on that basis, what I've done is I've sort of narrowed it down to some of the most important areas. Now, I've got a number of different slides here. So depending on the amount of time that we have and how intrigued you guys are in terms of some of the sessions and some of the slides, we will try to get through as many as possible. Some of the slides are a bit intensive, others are quite mild and easily understood. Hopefully, inshallah, with some of the visuals that I have with some of the slides, it might be a bit easy for you to understand. Now, before I begin, I will be starting off with the absolute basics so that some of you who don't have that much familiarity with the rulings of Ramadan, then you can sort of gain the basics, and then I can go into a bit more detail. Before I begin, you can fire away with questions. I've got the chat up here, so if anybody wants to ask questions anywhere through the slides, let's make this as interactive as possible. The more interaction we have, the more you will gain from this, and the more I will gain from you guys. So inshallah, don't hesitate to to ask questions, even if they are really basic questions. That's not an issue at all. Sometimes it's the most basic things that are the most fundamental things. Okay, so inshallah, we'll begin.
Sheikh Rafaqat, if I can just interject there, I will be inshallah taking any questions, so I will be following them up. But I believe you wanted to share your screen as well. Is that right?
Is my screen not being shared?
No. So if you just click onto the sharing section and just click on the play button, we should be able to. Yeah, there you go. Jazakallah khair.
You can see my screen. Yeah. Okay, that's fine. Okay, inshallah. Second. Okay, so let's begin. So here we have the aims of the session. The aims of the session are sort of multiple here. We've got approximately 5. So there's something about gaining an understanding of the instructions from the Holy Quran on fasting. So initially we'll just talk about some of the verses in the Holy Quran that give us some clear rulings related to Ramadan and fasting. Then it's about grasping who fasting is not obligatory for and who are excused. So there are certain concessions of those who are ill and who are traveling and so forth. We'll talk a bit about that. And then there's something about understanding the medical Shari principles for safe fasting advice for patients. So as medical professionals, at what stage do we decide that you're exempt from fasting because of your particular illness? So I formulated a kind of a rubric of principles that would make it easy for you guys to understand. And this is something that the ulama normally look at and what they observe when they make a decision in terms of who should be fasting, who should not be fasting. Then there's something about learning the principles and applying the rules of what medical agents and procedures invalidate the fast. This is usually the one which is most receptive. A lot of people ask a lot of questions related to this, and there is differences of opinion around a number of different areas, but I will go through this and try to present it in a way where you guys will benefit. And then finally, depending on the time that we have, issues of hardship for doctors and allied professionals related to fasting. I get quite a few calls during Ramadan from medical professionals, not necessarily about patients, but about them, and they tend to be around, you know, the fact that they have got a long surgical list through the whole day, and they struggle sometimes, and there are issues in terms of the fact that if they're not focusing throughout this whole session because of the fact that they're fasting, then are there any concessions for them not to fast? So I will talk a bit about that if we do get a bit of time. Okay, so the Holy Quran and fasting. So the verse of the Quran, Ya ayyuhalladhina amanu kutiba alaykum as-siyamu kama kutiba ala alladhina min qablikum la'allakum tattaqun. So this verse of the Quran clarifies a very important concept, that to fast is compulsory on all Muslims who fill the criteria, as it was compulsory on those before us. The whole purpose of fasting, لَعَلَّكُمْ تَتَّقُونَ, is so that you gain the concept of taqwa. And taqwa has been described in many, many different ways. There are books written on the subject by classical scholars in terms of what taqwa is. And taqwa is not just about abstaining from food and drink, but rather it encompasses a lot more than that. It's about your spiritual nature and you gaining a closeness to Allah subhanahu wa ta'ala, at-taqarrub ila Allah, and also the concept of self-restraint. Self-restraint in terms of building yourself up in such a way so that you abstain from sin, and also building your spiritual iman so that you become closer to Allah subhanahu wa ta'ala in your worship. Now, the verse continues, أَيَّامًا مَعْدُودَاتٍ فَمَنْ كَانَ مِنْكُمْ مَرِيضًا عَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرٍ. So here it informs us that the fast is prescribed for a number of days, 29, 30, except if any of you is ill or on a journey. So here already you will see there's a stipulated concession that is very clear in the Nas in the Holy Quran, that Allah subhanahu wa ta'ala says that this is not compulsory on every one of you, but rather لَا يُكَلِّفُ اللَّهُ نَفْسًا. There are those of you that are not obligated to fall into this situation because of the fact that you're ill or you are traveling. So here the idea is that if you do not fast on those days, then it's stipulated here, then فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرٍ, then you should fast a similar number of days later on. For those who can endure it for medical reasons, there is a ransom. So those, in other words, that if you cannot make up for that particular fast, al-qada of that fast, يُطِيقُونَهُ فِدْيَةٌ طَعَامُ مِسْكِينٍ, then the idea is the feeding of one poor person for each missed day. فَمَنْ تَتَوْعَ خَيْرًا فَهُوَ خَيْرٌ لَهُ وَأَنْ تَصُومُوا خَيْرٌ لَكُمْ إِن كُنْتُمْ تَعْلَمُونَ. And then, but if he feeds more of his own free will, it is better for him. However, if you truly understand the rationale of fasting, it is better for you to fast. So there is a real wisdom in fasting, and like I said earlier on, there are many books have been written on the subject in terms of what one gains from fasting. Then the verse continues, so it talks about the Ramadan, شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان. Then it talks about, goes back to the same concept, فمن شهد منكم الشهر فليصمه ومن كان مريضا على سفر فعدة من أيام أخرى. Talks about the same thing again, and this is the next part is the important part, where it talks about whoever is ill or upon a journey shall fast a similar number of days later on. And then Allah subhanahu wa ta'ala stipulates, يريد الله بكم اليسر ولا يريد بكم العسر. So Allah subhanahu wa ta'ala says, Allah intends your well-being and does not want to put you to hardship. So in other words, hardship is another concept that the ulama put forward regarding the concession related to fasting. So it's not solely always about just illness and trouble, but the idea there is about hardship in general. So, okay. Now, some very, very basic concepts related to Ramadan, which I'm sure most of you already are familiar with. is that Ramadan falls on the 9th month of Islamic calendar, and it's mandatory for Muslims to fast during this time, from dawn to sunset. The idea is to abstain from food and drink and sexual relations, and also some stipulate the idea of a smoking intoxicant from a more modern context. So here, clearly, for those of us who smoke, then smoking would be forbidden for you during the days of Ramadan. Then also fasting is one of the 5 pillars of Islam, so it clearly stipulates that, like Allah subhanahu wa ta'ala says, Kutiba alaykum as-siyam, that is being made a mandatory upon you. So on that basis, it's been considered as a pillar of Islam, and it begins after the month of Shaban and ends with Eid al-Fitr. So we have Eid al-Fitr, where we celebrate what we have gained from this blessed Mubarak month. Then there are certain terms that sometimes we use in terms of the times of fasting, in terms of when we open up our fast and break our fast. So suhoor, sometimes in the Indian subcontinent we call this sehari. Okay, so suhoor is referring to the meal before dawn, pre-fast meal, and iftar is basically the meal after sunset, and usually this we open with dates and water, and usually the first food to break the fast is the dates and water, because this is a sunnah. It's a sunnah of the Prophet sallallahu alaihi wasallam. And also sometimes we forget that we also consider night prayers as a very important part of Ramadan as well. So Tarawih is in essence can last from approximately 1 hour to 1.5 hours, and can be quite physically demanding for those who are frail, elderly, and even for children. Especially children who are going into school, and Ramadan is during the school days, then they're expected, sometimes they go and read Tarawih, and it's the passion sometimes. People, really want to gain that closeness. There's a community kind of passion there, and everybody wants to be part of that. And for that reason, you'll find many people go to the masajid and read the Tarawih in Jama'ah, in their congregation. Also, Ramadan is about increasing your worship. So it's about prayer, reciting the Holy Quran. The Quran holds a pivotal point in Ramadan, because the Holy Quran was revealed in Ramadan, and for that reason, it really is the essence of Ramadan. Though sometimes we don't really look at it that way, it truly is the essence of Ramadan. So the Quran is recited abundantly throughout the whole world during Ramadan. Also, we must never forget the fact that there is also those of us who are fortunate enough to do i'tikaf, and that is seclusion in a masjid for men, and it can be women in their own secluded area in the home. And sometimes what we do need to do as medical professionals, we need to identify these issues, such as the issues of Tarawih and also the issues of i'tikaf. So you may find sometimes, frail men. I've done i'tikaf a few times, and you do sometimes find frail men who are basically secluding themselves in the masjid during the last 10 days, and they can get sometimes quite ill. So there's many a time where I've had to deal with some of those individuals in a masajid. I always take my stethoscope with me, just in case. Okay, so fasting is not obligatory for the following. So these are important individuals, because Allah subhanahu wa ta'ala has made a case for them that it's not obligatory for them to fast. So here we have, initially we've got children under 12 years, i.e. under the age of puberty. So balugh, once they've reached balugh, then fasting becomes compulsory on them. You'll find that children even younger than 12 years fast, and the reason why they do that is because they have that they're in the culture of fasting, and it's a challenge for them. They, all their brothers and sisters, their siblings are fasting, people at school are fasting, and so for that reason you'll find that many of them want to try and do this as well, which is fine, and that clearly needs to be watched carefully, especially if they're very young. But you'll be amazed, how young some of these kids can be, yet they fast. Clearly, if you have kids who are young and they have chronic illnesses, like for example asthma or even heart disease and so forth, then you need to be clear about the risks to these kids. Okay, so there are also those people who are incapable of fasting due to physical weakness. So there is something about weakness. So patients who are acutely unwell or are frail or elderly. So as a that's a no-brainer. They're really going to struggle to fast. You also have those who are undergoing terminal disease. Okay, so these patients will be required to offer fidya. I will talk about fidya later on, but they will be expected to offer a fidya, and if they are not able to do qada, in other words, they are not able to make up for the fast at a later date, then that's the general consensus that they would have to give fidya. Then you have those patients who have chronic illnesses, chronic diseases such as diabetes, and also chronic pulmonary disease, so bronchitis. And these kind of patients, again, because they are chronic diseases, and they will, in essence, they will have these diseases for the rest of their life, and they may struggle fasting even during the winter months to make up. And for those types of patients, again, fidya would be the way forward. Then you have those patients, and sometimes we just look at physical illnesses, but yet we can also take into consideration mental illnesses or people who have learning disabilities. So, if they have poor insight and poor understanding of the rulings and the criteria of fasting, in essence, they would be exempt because they are not mukallif, basically obligated to fast and to continue with the rituals of fasting if they don't have the insight to the rulings of fasting. Okay, so just talked about some of the issues related to atonement and expiation. So let's say, for example, somebody who has been fasting and now they've become quite unwell. They have an acute illness. They've got flu symptoms, and they are basically resigned to their bed. They're unable to move from their bed, let's say, because of this particular reason, or they are basically struggling with some of the most basic chores, like using the bathroom and so forth. Now, depending on the seriousness of this, and this is something we'll talk about a bit later on, the idea is that they would have to make up for that particular fast. So this is any time after Ramadan, other than the Eid, Eidain, i.e. the Eid al-Adha and Eid al-Fitr, the Eid during at the end of Hajj, and the Eid basically after Ramadan. Those are 2 days where it's haram to fast. Other than that, they can fast any other day throughout the year and make up for that particular fast. Now, then we also have the concept of fidya, which is the atonement. And the idea behind fidya is that and sometimes people misunderstand the concept of fidya, what they do is, instead of doing qada, what they will do is they will actually give fidya, and that is not correct. So let's say, for example, you're quite young, and you're quite healthy generally, but during Ramadan you became unwell, you ended up with a chest infection, and for this reason you missed a few days of fasting, or you were traveling and it was quite heavy travel, traveling by plane to a different country, for example, and as a result of this you would struggle with fasting and you decided not to fast on that particular day or two. On that basis, then you would have to make up a qada, not give fidya, because you have the ability to make up for that fast later on in the year. Now, if you are unable to make up for that particular fast because of a chronic illness or because of frailty and because you're elderly, then on that basis, or you have a terminal illness, and on that basis, then you would pay what we call a fidya. A fidya amount varies between different groups of people, depending on different charities as well. And you will find that it can range between around about £2 to £5 per day in terms of how much you would pay up. Now, that might not sound an extensive amount, but if you think about those individuals who don't fast for a whole month, then that could be potentially around about over £100 easily, even a few £100s, depending on who you go to. Then, and if you collectively do that over a number of years, then it could, be quite a substantial amount of money. Then you come to the final one, which is the kafara. The kafara is what we call the expiation. The kafara is more of a serious element to this, and this is more related to the idea that somebody who has the ability to fast clearly is healthy enough to fast, and there are no concessions. This person decides that they do not want to fast, and it's voluntary, so it's not that they're being compelled to. So there's clear a willingness not to fast, and as a result of this, they either go through this process, so they fast, or they may decide to fast, or what they end up doing is they start eating food or drinking, and it has to be the fact that their fast has become invalidated as a result of things which clearly break the fast and are clear, explicit in the hadith. So on that basis, so basically things like, for example, eating or drinking, all these different sort of elements there would break their fast to the extent that they would have to make up for a kafara. A kafara is a kind of a penalty that you have to pay for through the process of fasting. So what you do is you fast for 60 consecutive days, one after the other, and you would continue to do this without any breaks. Those women who are basically menstruating, what they would do is those menstruating days, they would be exempt from those days, and then they would just continue making up for the 60 days after that. Even so, for those individuals who are unable to do this, they are unable to perform kafara over 60 days due to ill health, then for them, then they have the option to basically feed the poor for 2 meals for 60 days, or 60 consecutive 2 meals for 60 days, or to feed 2 people over 60 days. Okay, so let's just talk a bit about the principles for safe fasting advice for patients. And before we do that, this is a little exercise. So the exercises, and I want you to think about this. So the idea, it shouldn't be just about me talking all the way through, but you guys actually thinking. This is the kind of situation you may come across. So in your mind, if let's say, for example, you guys are medical professionals, in your mind, when people come to you, and for example, a patient who suffers from asthma and hay fever, what kind of things do you think about when you decide whether this individual should fast or not fast? Or it may be a frail elderly woman, it could be a young man with severe back pain, it could be a woman recently delivered, okay, and suffering from depression, so he's got postnatal depression, or even a young boy sitting for his GCSE exams. So somebody's come to you as a medical professional and they want your advice. They've learned that you've attended the Ramadan initiative of Bima, and you've gained some knowledge on the issues and the fiqh of fasting in Ramadan. So they've come to you and they're asking you, okay, right, so you know, my son, he suffers from asthma and hay fever, should he be fasting? So think about this, and what I'll do is I'm going to give you approximately a minute or so, okay, to just think about this, and you know, think of a structured way, ideally, of how you would decide in each one of these cases at what point you would decide that this person should not be fasting, and then you would give them that particular advice that I would highly recommend that you do not fast. Clearly you can't force people, but you can only give your professional recommendation. And one thing to remember is that many people approach the imams of masajid, you know, regarding these things. So they'll approach an imam and they'll say, you know, I suffer from asthma and hay fever, should I be fasting? You know, an elderly woman or elderly man may approach his imam and say, you know, I struggle a bit, I've got a bit of heart disease, should I be fasting? You know, people severe back pain even. So I'll give you 1 minute just to get you to think, and just briefly just outline at what point you think that you would indicate to these individuals that you recommend that they do not fast. So Rashid, are the students able to use the chat?
Yeah, so the attendees can all either raise their hands if they want to ask the question in person,
Okay.
Or they can type in. So we've got 3 questions already there, Sheikh. If you look at the question section, I think they've been posted a bit early before this exercise began.
Right.
So I hope you can see those questions as well.
Okay. Right. Just 1 second. I'm trying to find the question section here. Okay. 1 second. Sorry, I'm not sure what the question section is here.
Right. Okay, that's fine, Sheikh. I'll tell you. I mean, these questions were posted a bit early before the exercise began. I mean, if you wanted to leave them till late, it's up to you.
Yeah. What I would recommend is if it's related to the slides, ideally, then you could go through it in a quite structured way. But you know, if there's quite burning questions, some burning questions there related to later, because I will cover quite a bit here. So you know, if they're related to some of the issues later on, then we can bring them in at that point.
Sure. So anyone who wants to ask the question, you know, if you're using your mobile phone, you can raise your hands. There is an icon for that. And anyone who wants to type in, you can use the same thing as well. So, inshallah, any questions there? Any comments? Anybody?
Okay, that's fine. Right. Okay. So regarding this exercise, there's clearly a couple of things that you guys might want to ask. So it may be something along the lines of.
So there is a question here. I think Sister Farah, she wants to ask a question. I'll unmute you, Sister Farah, so you can ask a question from the Sheikh. So you have to unmute. You have to unmute yourself as well, Sister Farah.
All right. Can you hear me now?
I can hear you.
Yes.
Yes.
Right. Okay. Salam alaikum, Shaykh. My name is Farah, and my question is regarding the third example, which is a young man with severe back pain. Regarding your previous slide on the patients which are not obligated to fast, and I think frailty or chronic diseases such as diabetes and COPD are much of a simpler example, and we can understand why these patients can't really fast. Like, for example, diabetes, which is a bit complicated because it it directly affects like fasting and diabetic complications due to fasting. But with severe back pain, in what sense can it affect fasting, or is it like them waking up for iftar that is preventing them from fasting? Or can we just put all the chronic diseases and assume that these people are not obligated to fast? To what severity is chronic diseases or conditions warrants that exemption from obligation is basically the question.
Okay. Now, it's not uncommon. It's not uncommon to have people like this. I had somebody who had gout, and quite severe gout. And they were taking, colchicine, and they were taking a number of different strong painkillers, opioids, taking codeine and various other things. And this individual was really struggling even getting out of his bed. So on that basis, there is a point, or shall I say, there's a whole spectrum of time where you would consider that this individual now has reached a stage where I probably would recommend that they shouldn't fast, because it would be quite problematic for them. Because if this individual started to fast, that would mean that they probably would not be able to take that pain relief to the extent they are able to at this very moment in time. Okay, we'll come to this. I've got another slide that's going to appear after this, inshallah.
So Jazakallah khair, Sister Farah. Okay, so I've got a couple of comments and questions. So Brother Umar Sharif says that first 4 are exempted, and that's his answer. Brother Amir Bernie, he says, Assalamu alaikum. I think the difficult one here is the boy giving the GCSE exams.
Okay.
Is there something you have across, or is this something you have often come across, especially as Ramadan has moved into the exams period in UK? Thank you.
Okay, so GCSE exams and children sitting in GCSEs are very important for for all kids who are doing them. And the idea here is with GCSE exams, because the system that we live in, especially in the UK, the education system that we live in, GCSE exams are the door to further education. And in essence, that has a massive impact on the future of a child. So there are many, many reasons why people explain the importance of ensuring that kids are performing to their max during GCSE time. And you have even incidents of kids that suffer from anxiety prior to GCSE exams and so forth. But the main point to take from this is, what are the Sharia obligations in terms of fasting and bearing that, the issue of hardship. Now, I've got a whole presentation towards the end. If you get the time, we'll go over the concept of mushaqqa, which is to do with hardship. So majority of the ulama basically say that there are alternatives, means of dealing with kids to ensure that they can perform during GCSE exams. And to actually say to them, look, you don't have to fast, would not be acceptable. So, for example, ensuring that they get a good night's sleep, ensuring that they get a good meal at suhoor, ensuring that they're very well hydrated. Now, if this child has other illnesses, for example, he may have asthma or something along those lines, and he's got a slight exacerbation, then if he's being excused from fasting, it's because of his health, not because of the fact that he's having GCSE exams in itself. So for this reason, GCSE exams in itself are not good enough an excuse for that particular reason. But rather, the importance in there is that we need to make sure that these kids are, having the right kind of food, they're getting plenty of sleep, and they have a good timetable in terms of their revision to ensure they're not doing all-nighters before the exam. And also ensuring that they're getting to bed on time during Ramadan as well. Okay, right. So let's just move on to the next slide for the moment. And what this slide basically does is it will explain some of the factors that we need to consider. And these are some of the things that ulama think about when somebody asks them questions related to the issue of whether somebody should be fasting or not. And you'll find that there are certain indications to these things in the kitabs of fiqh. So one of them is in terms of worsening physical condition. So if this individual continues to fast, then their physical condition will worsen. So for example, a person who has a chest infection, and if he begins to fast, the chances are he will become more dehydrated, he will feel a lot more weak. And as a result of this, what will end up happening, his condition can become more exacerbated, his infection could basically progress, and he could become a lot more unwell. So this could be something simple as even a flu symptoms, which are extensive enough for this person to be unable to carry out his daily chores. The other aspect is slow recovery. So if this process is going to slow your recovery by fasting, so for example, again, it could be the same instance, somebody who has a chest infection, and if they are to fast, then their recovery would slow down. Now, in each one of these cases, there is a point at which you would decide that this is a point where I need to now recommend this patient does not fast. Now, I'll come to that in a second. But generally speaking, these are things that you need to think about. So there's something about the condition becoming worse. There's something about the recovery being delayed as a result. There's something about worsening mental conditions. So let's say somebody has schizophrenia or depression, and clearly they're expected to take regular medication. As a result of this, they are taking the medication, but because they're becoming weak, there's a possibility that that can have an impact on their mental health as well. So as a result of this, you need to take that into consideration. Also, the fact that certain people may have quite severe pain. So somebody has a lower back pain, which is quite severe to the extent that they are unable to physically or mentally perform normal and important daily chores. So these kind of individuals struggle to get to the bathroom. These kind of individuals struggle to do their normal daily things, go downstairs, have their breakfast as they would normally, in time. They're unable to care for their children even. So it may be that they have a lot of dependence on them. So basically, there are a number of kids. So it may be a mother who's not well, and as a result, she's expected to take care of her kids, and that could potentially be an excuse for her not to fast if it's quite demanding for her to do this, to the extent that it's going to worsen her physical condition. It could slow down her recovery if she's got, let's say, flu symptoms and so forth, or even her pain. Now, I remember a case where a pregnant woman had lower back pain, so she's got two excuses. One is the severity of the pain in her back, and the other one was related to the fact that she was pregnant. So, clearly that was a quite clear-cut case. But if she wasn't pregnant and she was having severe back pain and she was taking regular pain relief through the day, and if she doesn't take these painkillers, then chances are that she's going to struggle even getting downstairs and so forth. Then in those kind of instances, then there is that scope for us to recommend that these particular patients do not fast, or they have a concession. Okay, so hopefully that's addressed some of the questions. Let me just see. I think there's a little bit of chat here. Okay, a second. Right. Right. Okay. Just reflecting on what we talked about earlier on. So clearly here, somebody who's suffering from asthma and hay fever, feeling very wheezy through the day, nasal congestion, struggling a lot. Now, if he's just got a bit of wheeze here and there, then that's not too much of an issue. But clearly, if the patient's got wheeziness and they're becoming quite short of breath with this, depending on whether you believe that inhalers invalidate the fast or not, let's say, for example, they do, in that instance, then patients like this, they would be exempt from fasting if they're becoming short of breath. And as a result of this, the idea would be that they would have to do qada, they would have to make up for the fast, maybe during the winter months when the days are shorter and they don't have the asthma exacerbation. Same thing with frail elderly women, or man. So here again falls into the same remit about being frail, weak, and as a result of fasting become even more so weak. We talked about the severe back pain. A woman recently delivered suffering from depression we talked about, and we've also mentioned something about children who are doing GCSE exams. Okay, right. Now, just related to diabetes, there are clear sort of guidelines in terms of what would be considered as very high risk diabetics, what we consider as high risk, and also moderate to low risk. So in essence, all the above would be considered as recommended not to fast. So there was a must not fast. Anybody who's type 1, poor control, has frequent hypoglycemia, i.e. low blood sugars. They've had a risk of DKA, so diabetic ketoacidosis, ended up in hospital, a severe condition, and other major comorbidities. They have additional conditions such as heart disease and so forth. Those kind of individuals clearly should not be fasting. They're putting themselves at risk, and from a Shari perspective, it would be probably likely that it could be very potentially seriously dangerous for their and life-threatening if they fast. Then you have the high risk, so they could be people who are type 1 diabetic, who are even good control. Okay, so here you'd sort of tell them they should not really be fasting, but some of these patients decide they want to fast. So you may have type 2 diabetics who have got poor control or on insulin, and you've got those who may have a risk of hypos. They don't have regular hypos, but there's a risk of them having hypos. And those kind of individuals, you'd expect them to check their blood sugars through the day quite frequently, and you would advise them in a certain way. Then you have the moderate to low risk patients who can fast, and you have mainly type 2 diabetics. Many type 2 diabetics fast, and they're usually ones who are well controlled on oral medication and diet controlled. Or there may be type 2 diabetics on insulin, and there's no history of them ever having hypos. So those kind of individuals can fast. Now, question is, should they fast? And the should they fast would be dependent on, again, the concept of risk, which a medical professional would have to make a decision on. And the kind of things you would take into consideration is their risk of hypos and their risk of diabetic ketoacidosis. Those are the sort of two main sort of features. Also, the fact that these individuals could end up getting dehydrated through the day and feel very weak, unable to perform their daily chores as a result of their weakness. And again, you would advise them in that instance not to fast. So you need to provide structured education for these individuals. You need to counsel them about the warnings of dehydration, hypoglycemia, also the fact that they should be checking their blood sugars through the day quite frequently to ensure that they don't become hypoglycemic. There are other conditions. So there are, for example, things like chronic respiratory disease, COPD, emphysema, and so forth. If that's symptomatic, then that clearly would be an excusable condition. Heart disease, moderate to severe, coronary artery disease, severe controlled hypertension even. Chronic renal diseases as well. Anybody who's on renal dialysis should not really be fasting. Somebody's had an organ transplant, such as a kidney transplant, depending on their state and their general health overall, I've seen many who do fast even in that state. So depending on the risk to them. Then also you have those who are immunocompromised. So are they taking sort of immunosuppressants? They may be on steroids and so forth. Those kind of individuals, you recommend that they don't fast. There's also those who have chronic severe mental illness, as well as those who have an acute illness such as asthma exacerbation or a chest infection or severe flu. Okay, so the next part of this session is mainly focused around the principles for the invalidation of fasting by medical agents. So this is something that many people are interested in. So what I'm going to do is I'm just going to explain a few simple concepts in this. And before I do that, I want you to just think about these particular individuals here in exercise 2. So what we have here is we have a patient using an asthma inhaler. Okay, so now the fact that this individual is using an asthma inhaler does that invalidate his fast? So you get individuals who ask this question. There is a bit of confusion about this out there. So what's the issue here? A patient having a blood transfusion, somebody who's taking insulin, a woman who's using a vaginal pessary. I remember somebody who was a lady who's subfertile, and it so happened that during Ramadan, she was expected to have her fertility treatment, which required her to have a number of vaginal examinations through the month of Ramadan. And she went to an imam, and the imam told her that basically that will invalidate her fast. And this woman was in tears because it has to be, the timing has to be aligned appropriately for her to have this particular therapy for her fertility treatment. She actually made a conscious decision not to fast during that month. And, you know, it's quite sad that that's the situation that she had to go through when clearly there was incorrect information what was given to her. Then you have also an elderly gentleman using a urinary catheter. So, you know, which one of these invalidate the fast? You know, what kind of advice would you give these individuals? So these are sort of things that you guys need to think about. So I'm going to open this up to you guys again. Okay. So if there's any particular questions related to any of these, or what would you do? So if you sort of list your 1, 2, 3, 4, 5, and just put next to each question, you know, it'll break the fast, it won't break the fast. Just get a bit of an idea about what you guys think of each one of these individuals. So if you guys have any questions, you can ask questions related to each one. Ideally, what I would like is commentary rather than asking questions at this stage, because a lot of your questions will be addressed as we go through the next few slides. Okay, so I'll open up to you. I'll give you a short while to reflect on some of these individuals.
Shaykh Rafaqat, while the attendees are having a think about it, I just want to suggest, you know, if you look at the tabs on the right side, after the sharing tab, there should be a tab to be able to see questions tab. You can undock it from the pane to make it bigger. Just like you got a tab for chat at the very bottom, you should have a tab for questions as well.
Okay, I've got a sharing tab, and then I have a webcam, then an audio and attendees. I don't have a question tab there.
Okay, I'm not too sure why that's it. Okay, that's fine. What I'll do is I'll try. Have you got the chat tab there?
I've got the chat tab, and I'm quite happy to take the chat, the discussion on chat. That's fine.
Okay.
As well.
Yeah. So what I'll do is I'll put those questions on the chat tab, inshallah.
Okay. No problem. Inshallah. Okay. So it'd be interesting to hear some of your comments related to these individuals. Okay, so I'm happy to take some of your comments. So somebody who's basically using an inhaler. So do inhalers invalidate the fast? What are your thoughts? What do most of you think? Also regarding a blood transfusion. So blood transfusion, venous entry, and also giving blood, which is in essence a form of nutrition. Okay, would that break your fast? So somebody who's not feeling very well during Ramadan, yet they decide that they want to continue to fast through the day, and as a result they've been admitted to hospital and they've been given a blood transfusion. So would that invalidate their fast? Also, a patient who's taking insulin. So somebody who's basically injecting themselves, administering insulin during, let's say just before iftar. Okay, so they decide to give themselves insulin, and somebody comes to them and says, "Oh no, you've taken insulin. That's invalidated your fast." So what would be the issue there? And also somebody who's basically using some kind of pessary, be it vaginal pessary or even an anal suppository. Okay, would those things invalidate your fast? And also you've got an elderly gentleman who's using a urinary catheter. So he's inserting a tube basically and in his urethra, and as a result of this, he's got this constant flow of urine into his catheter bag. So would that actually break his fast? There are other questions related to this in terms of whether it would actually invalidate your wudu as well, your ablution, which is a separate question altogether. Okay, so let's just carry on. If there are any comments, Arshad, if you have any comments from the attendees.
Oh, I can read through the comments, Shaykh. I think we're having some trouble here. So, Brother Elmas is saying inhalers do not invalidate fast. Amir Bernie says that no problems with catheter pessary, in my opinion. So, sorry, that's not. Okay, I'm looking for inhalers at the moment. Inhalers, degree of symptoms, yes, but if the symptoms are not bad, then no. That's what Brother Umar Sharif said. Okay, from my knowledge, inhalers do not invalidate fast, but venous entry would. Shazia Hussain.
Right.
Apply principle of whether medical device reaches stomach nutrition. Sister Madia Wahid. So that's all related to inhaler.
That's fine. Okay, so let's go into this in a bit more detail. Right. Now, hopefully you can all see this slide quite well. Now, this is a kind of a visual of the kind of things that ulama discuss on the issue of those things that are that invalidate the fast. Now, in each particular case, if you have a look at this, hopefully you can see my cursor flying around. Okay, so here there's a couple of things that they need to look at. The first is what we call the Jawf al-Mu'tabar, which is the qualified cavity. So what particular cavity do we have in our body that if any particular agent was to enter into this cavity would actually invalidate our fast? Okay, so there's a big debate, a big discussion amongst the four Sunni madhabs, so the Hanafi, the Maliki, the Shafi'i, the Hanbali, regarding what the Jawf al-Mu'tabar is. What are the qualified cavities? And the kind of discussion that goes on there mainly falls on the remit of the throat, okay, and the throat being post-pharynx, so after the pharynx, down to the rectum, okay, all that particular area is considered as the Jawf al-Mu'tabar. So that includes the throat, the stomach, the intestine, and right down to the rectum. So that is considered as a qualified cavity by the Hanafis, the Malikis, and the Hanbalis, some of the Hanbalis. However, the Shafi'i, interestingly, what they do is they basically stipulate that any kind of cavity in the body, if any kind of agent, a qualified agent, was to pass into that cavity, then that would invalidate the fast. And amongst the Shafi'i, there are those who basically say it has to be either food or medication for it to break the fast. But I'll go into that a bit more later on. And the reason why I'm giving a bit more detail in terms of the different schools of thought is because the differences that tend to arise as a result of the differences of the schools of thought. Okay. Now, on that basis, if you look at the idea now in terms of the cavity, the next element is what we call the Munfas al-Mu'tabar, which is basically the qualified passage or the opening that leads to the cavity. So this is a section just before the cavity, the passage that leads, or it could be an aperture, it could be some kind of opening, it could be another cavity that leads to this central Jawf al-Mu'tabar, the qualified cavity. Now, this particular connection or communication that exists before we get into the cavity, okay, there are differences of opinion related to this as well. So this has to be, the question arises here, does this have to be a congenital? Can it be a congenital cavity that's not a natural cavity or a natural passage? Yeah, or can it be a wound? So if I was to insert, so that one of the questions that arises in the books of fiqh is if somebody spear into your stomach, and the spear would enter your stomach, and then as clearly it would wound you, and it would go into the stomach, and as a result of this, the end of the spear would actually break off and fall into your stomach, and then the person was to withdraw the arrow, or they would withdraw the spear, would that invalidate your fast? And there's a difference of opinion related to that, but generally speaking, most of them would say it would. And the reason why that is that even though that's not a natural passage, in essence, what it is, it's a passage that's there because is acquired as a result of a wound, and that would qualify as a qualified passage. So there's a qualified passage, the Munfaz al-Mu'tabar, and there's a difference of opinion in terms of what qualified passages may be, depending on different scholars. So some even say, this is the nasal cavity, the mouth, the anus, and there's also discussion about the vagina, the urethra, and all these different sort of passages being a Munfaz al-Mu'tabar. Okay. Okay, so next thing is the qualified agent. So what qualifies as something which would invalidate the fast? So the things that qualify may be solids, they could be liquids, they could be it could be food. In essence, it would be food. So the instances where kafara would need to be made would be instances where it's food or drink. Okay, but it could also be things like, for example, a small pebble. Somebody swallows a small pebble, so that's a solid. It's not edible, but yet that would break your fast, according to the majority of the fuqaha of the juristic schools. So that's the next point. That's a qualified agent. Does it have to be liquid? Does it have to be gas? Can it be gas? Can it, and so forth. We'll talk about this in a bit more detail later on. Then you have what we call the absolving states. So even though we've talked about the qualified cavity, we've talked about there has to be a qualified passage, and there has to be a qualified agent, there's also a process. We'll talk about the process. What is the process? Does it have to be via a qualified passage into the cavity? does it have to be such that there has to be independent stay? So for example, if you were to insert a suppository is inserted, there is independent stay there, okay? And if you were to examine the anal passage, so what you do is you insert your finger, and there is no independent stay there because you will have to withdraw your finger. So let's say I have some KY jelly on my finger and I do an anal examination, and would that actually invalidate somebody's fast? What I'm going to do is I'm going to withdraw my finger, so there's no independent stay. Does that invalidate your fast or not? So there's a lot of discussion related to that. Also, there are absolving states. So al-mani' are things like, for example, sleep. So when somebody falls asleep and somebody places something, or let's say they were sleepwalking and they drink water in the process of sleepwalking, would that invalidate their fast? Or they are unconscious, they are under anesthetic, and one of the anesthetists basically inserts something via the nasal cavity into their stomach, would that invalidate their fast, and so forth. Okay, so there's quite a bit of discussion related to this. Let's just go to the next slide, and we'll just briefly outline some of those things in writing in terms of what each cavity represents. So here what we have is we have the qualified cavity. So that in essence, everybody's unanimous, the fact it's the stomach, the throat, and the intestine, which leads from stomach to the rectum. However, like I said before, the Shafi'i, they qualify any kind of cavity in the body as basically a jawf al-mu'tabar, as they would say. Then you have what we call the qualified aperture, or the passage. So this is any orifice or opening on the surface of the body, be it natural, it can be congenital, or it can be introduced, such as through a wound. So like, for example, a peg tube, a gastrostomy tube, that is clearly inserted from the outer lining of the skin into the stomach to feed individuals, enteral feeding, that would qualify as something that would invalidate the fast, which communicates with a qualified cavity, a jawf al-mu'tabar. The mouth, the nose, the ear canals, only if the eardrum is perforated. So there has to be a connection between the passage and the cavity for it to invalidate the fast. So clearly, if you've got a tympanum, the eardrum's still intact, it's not perforated, then there is no passage from the ear to the throat and into the gullet, into the stomach. The rectum, okay, wound, which penetrates through the stomach, which we talked about earlier on. Okay, then also the following are not considered as qualified apertures. So for example, in light of hadith and so forth, so for example, eyes, so kohol is basically is to insert what we call surma into the eyes, okay, and that would not invalidate your fast. There's hadith to specify that. And also the pores of the skin. So the pores of the skin can potentially be considered as ports of entry into your bloodstream, etc., but they don't lead directly to the qualified cavity. So the skin is not, even the pores of the skin are not considered as what we call al-manfas al-mu'tabar. Okay, then we have what we call the qualified agent. Okay, so agents that rejuvenate the body, so food or medication, or do not rejuvenate the body, okay, are all considered as ones that invalidate the fast. So even if you were to swallow an object which is not food or medication, that would invalidate your fast. Also, agents that are edible or non-edible, agents that are liquid or solid, agents that are soluble or insoluble, or following do not invalidate. So air, because air is a natural concept, okay, so which is always around us, so due to arduousness, it would not be considered as something that invalidates your fast. And sensations of extremes of temperature, so feeling the hotness in your stomach doesn't invalidate the fast. Putting something in your mouth which is cold will not invalidate your fast, and so forth. So according to the Hanafi school, when it comes to qualified process and means, to nullify the fast, it requires there to be independent stay, which I talked about earlier on. So on entering the qualified cavity, the agent should disappear from view. So potentially one of the issues that arises is if you were to have a piece of meat attached to the end of a string, it's a hypothetical situation, and you were to insert this down the throat into the stomach, and then you were to withdraw this again, okay, as long as there's no remnants of the piece of meat that would remain, that will not invalidate the fast, interesting enough. So because that has not gained independent stay. So that would give a good understanding around, for example, endoscopes and gastroscopies and things like that we use, in terms of whether they invalidate the fast or not. The other is about on entering the qualified cavity, agents should disappear from the view. So for example, suppositories, you insert them the rectum, and as a result of this, they disappear from your view. Okay, so on that basis, that would be considered, according to the Hanafis, that they would invalidate your fast. Okay, I'm sure you all got a number of questions. We'll address your questions in a short while. Then finally, states which absorb the qualified nature. So these are al-mani'. These are things like forgetfulness, nisyan, arduousness, so fumes, vapor, dust, saliva, mucus. All these different things would not invalidate the fast. The following not excused are things like necessity. So out of necessity, you become very unwell, and as a result of this, now you must take certain medication. Regardless of the fact that it's a necessary thing for you to do, it will still invalidate your fast. Ignorance, oh, I didn't know that, doesn't matter. The main thing is that it's something which invalidates your fast. Your ignorance is not an excuse, so it's important that you go out and learn what invalidates your fast, what doesn't. An accident, you were to fall over, and you were to swallow a fly, for example. Okay, you go into a sort of green area, there are many flies there, and you've swallowed a fly, and that was accidental. That would not. And now there are issues where accidentally things can sometimes happen, but the accident here that we're talking about, ignore the one about the fly. You're excused in situations like that because that was an issue of arduousness rather than an accident. So an accident would be something along the lines of the fact that you forgot, in other words. So you forgot that you were fasting and you drank some water, okay, and clearly that would not invalidate your fast. But an accident in itself are things, for example, the issue where you're very conscious of the fact that you are fasting, and by some means something entered into your throat. So, for example, let's say you were having dental treatment and you were sort of gargling on some water or some kind of mouthwash, and it went down your throat. That would invalidate your fast. So coercion, if somebody forces something down your mouth, that would break your fast. Sleep, if you were to do anything during sleep which invalidates fast, that would invalidate your fast as well. So if you were to eat something during sleep, that would in a state of unconsciousness. So these are the 5 criteria related to fasting. So here, let's just summarize. Number 1, there has to be the criteria must be met for the fast to be invalidated. There has to be a discernible, visible substance, in other words. Okay, so this is to do with the wasin, and the substance reaches the digestive system, throat, stomach, or intestine. So it has to go through a munfasil mu'tabar to a jawful mu'tabar, which is the cavity, qualified cavity. The substance enters from an entry point connected to the digestive system. So it has to be an entry point which connects to the digestive system. So in other words, vagina or urethra, these do, or even an ear canal, does not necessarily connect itself to your digestive system, so they will not qualify as munfaz al-mu'tabar. Historically, it was considered that these particular channels did connect to the digestive system, such to the extent that people even believed that the brain cavity was actually connected to the throat and hence to the stomach. And for this reason, any kind of injury to the brain was considered as one that basically would invalidate your fast. So if you were to look in fiqh books, they talk about injury to the brain, injection into the brain, that would actually invalidate your fast. And also any kind of medication which was inserted intravaginally or through the urethra, that would actually invalidate your fast as well. But it's clear now, because of the science knowledge that we have, that they are not connected, and hence they would not invalidate your fast. The substance gains an independent stay. Okay, there is no excuse present, such as the fact that the individual, there was arduousness or the fact that the individual had forgotten, and so forth. And then these 5 criteria must all be met for the fast to be invalidated, and any of these are not met, then the fast is not invalidated. Okay, so that gives a brief overview, okay, and gives a bit of an idea about some of the issues related to this. Now, I'm just going through some of the questions that you guys have. Right, okay, so let's just go through some of these questions, then I'll go through some of the other more interesting stuff. Okay, let's have a look. Let's,
sorry, Shaykh Rafaqat, while you're going through the questions, what I would suggest is that those people who want to come and ask questions live, I would prefer that you do that while Shaykh is having a look, because we're having some trouble passing on the questions to.
Okay, that's fine.
Yeah. So if someone wants to ask any question in person, coming on live, you can raise your hand. So Arim Ismail, I'm unmuting you. You have to unmute yourself as well before you can ask the question.
Okay, Assalamu alaikum, Shaykh. I want to backtrack with one of the questions that you've asked. My son is sitting his A-levels, and even with all a lot of what you're saying today actually is putting me at sort of unease, because I think concepts and things that I've had, which were right and wrong, have changed quite a lot. And the thing about, as a person who has studied, as a mother, I know my son will find it very difficult to maintain the level of concentration he needs whilst he's fasting. And backtracking to what you said, that Allah makes it not difficult for us, I think as professionals and as people that would be asked, there would be some people that maybe want me to give that advice and take away some of that responsibility when I say, no, he's not obligated to fast. But really thinking laterally, is the evidence there that fasting has no effect on your ability to concentrate and your ability to perform? I can't believe that is true. So someone sitting their A-levels, really, I personally find it very difficult to say to him that he should, even if he wants to. I would say no.
Can I come back to you on that? Because the important thing is, we shouldn't, I'm not saying that you're emotional about this, but sometimes our emotion is not a source for us to make decisions in terms of what is correct or right or wrong. I'm not saying that you're emotional about them.
No, I am emotional about it.
Yeah, but it has to be a very principled way in which we make decisions in terms of, so there are principled approaches. You know, everything that I'm telling you here, they are clear from the text, and there are principles of how we make those decisions. Now, when we come to the slides, if you get the time on hardship, I will explain that to you in more detail. Can we leave it till then? Because I don't want to, there's a couple of other questions that want to come through. Then I'll come back to the issue of hardship.
Sure, we got Nuzha Ali now. You can unmute yourself. Nuzha Ali. Sorry, we can't hear you, Nuzha Ali. Okay, sorry about that.
Okay. Right, okay. So there was a question from an earlier question regarding pregnant breastfeeding women. How strict is the cutoff of not fasting? The issue regarding pregnant and breastfeeding women is that this is clear from the classical scholars, that pregnant and breastfeeding women are exempt from fasting. So in essence, they don't have to go through a serious amount of hardship before they're exempt, because it's clear in the text of what the scholars are basically mentioning. So there's no high threshold for those kind of women. Okay, so there's something about making up fast every Sunday of week only. What is the ruling on this, as it is day of worship for Christians? Okay, not very relevant to the idea, but generally speaking, if the intent, it's all to do with inna a'mal biniyat, it's to do with your intention. So if your intention is because Sunday is an easy day for you to fast, to make up for fasts, then there's no reason why you can't. Menstruating women making up for fast, not qada. Okay, I'm not sure what that question is referring to, but just generally speaking, menstruating women clearly cannot fast. So if it's a time other than the fact that they're menstruating, then they can do the qada any other time. Questions okay, what else have we got? We got something about can you, just one second, can you please expand okay, we've talked about that already. Let's just get to some of the ones at the end. The difficult, okay, so I think this may have been the same sister who asked about the GCSE question, so we'll come back to that later on when we talk about mashaqqa. Something about inflammatory bowel disease such as ulcerative colitis and Crohn's disease. Again, somebody who has ulcerative colitis and bowel disease, then clearly those are kind of individuals you would have to assess, number one, whether they're having an exacerbation. And some of these patients sometimes can be at risk of having an exacerbation through a long, prolonged fasting period. So as a result of that, it's quite important that we look at this from that perspective as well. So in essence, you need to take into consideration that these kind of individuals, if they were to fast, would their condition become exacerbated? And clearly, would it be exacerbated to a level where they would become very unwell? And if they would, then for that reason, then they are excused. Okay. Somebody talked about A-level exams. Okay, we'll get back to that. Depending on severity of disease and dosage regimes, considering different formulations, once daily, etc. In my opinion, many of these patients could fast, and that's true. So, for example, even pain relief, you could potentially have long acting opioids. But remember also with long acting opioids, unless they're once daily, even the twice daily ones, you're expected to take them every 12 hours. You know, the fasting period is longer than 12 hours. So, you know, clearly that may still be problematic. Okay, the descriptions are too ambiguous for questions 1 to 4. I feel, well, generally we'd learn to know they don't have to fast. Okay, okay, we'll come back to that in a second. Okay, right, just 1 second. Let's get to some of the ones that are at the bottom here. So women who want to take contraceptive pill to stop periods as their cycle gets shorter in Ramadan and lose 12 to 15 fasts, can they take it? In essence, reality is that it's not prohibited for them to take a pill to delay their menstruation during Ramadan. And for some reason, it seems to be becoming a bit more popular. You're noticing more women doing that. They want to gain the benefit. The main thing to understand there is that during Ramadan, women are given concession who are menstruating. So, you know, there's no, you know, to accept that concession and just go through it naturally would be, you know, probably the most right thing to do. But clearly those women who feel that it'll be problematic for them to make up for a fast later on and they want to gain the greatest benefit, if they were to take a pill, then there would be no sin upon them to do that. Okay, if you are on a period you cannot fast, the obligation to make this up is under kafara. No, you would not do kafara for a period that you have. So basically, if you are menstruating, you would just do a qada. You would not do a kafara for that. Kafara is more of a serious penalty, which requires you to make up for a fast that was willingly broken due to you taking food and so forth. Okay, right. Just conscious of the time, so I will have to just quickly go through some of these things. Right, okay, let's just go through this sort of briefly. So let's look at the skin, for example. So if you look at the skin, acupuncture, cream, lotions, deodorants, these things, anything that goes via the skin and absorbs through the skin will not invalidate the fast because the skin is not a valid entry point, okay? Then we have things like, for example, gastrostomies and peg tubes. Yes, they will invalidate the fast. The peg tube, because that's formulating a passage into the stomach, so that invalidates the fast. And then obviously your enteral feeding would cause the fast to break. Then there's something about gastrostomy, and gastrostomy is basically as if it was just an instrument that's being inserted into the throat, down into the esophagus, down into the stomach, then there's no harm in that. The only issue arises because we place you know, sprays, and we also put gel onto the gastroscope. For that reason, the gastroscope will become a remnant that will remain in the stomach lining, and that would potentially invalidate the fast. Injections and fluids, you'll see there's a difference of opinion there, but generally speaking, any kind of injection which is subcutaneous, would not break the fast. Intramuscular would not break the fast. If it's intravenous, as long as the injection is such that you'll see the difference of opinion arises on the basis that it's of nutritional value. So if the injection is of a nutritional value, that would actually invalidate the fast, according to some. To others, they would say that this is not a valid entry point, and hence it would not. So you'd find that majority of the Hanafis and the Malikis, for example, they would actually say that it would not invalidate the fast because there's no valid entry point. But you'd find some of the Shafi'i, they would actually say, because of the fact that and the Hanbalis, because there's a nutritional value in there, they would say that invalidates the fast. So depending on what kind of school of thought you are or your imam is, you'll find that different people give different verdicts on that. Patches don't, because there's no invalid entry point there. Inhalers. Now, inhalers is an interesting one. We'll come back to inhalers in a short while once I've gone through some of the others. So we talked about endoscopes. We talked about lighting incense. Clearly, it's unless you physically, voluntarily, willingly you inhale the incense quite considerably, then that would invalidate the fast. But generally speaking, lighting incense doesn't, because it's not a discernible substance there, so it would not really, in essence, invalidate the fast. You'll hear differences of opinion regarding nose sprays and nasal sprays. Sort of falls into the same remit as inhalers to a certain extent. The nasal cavity and the throat after the pharynx, or before the pharynx, shall I say, those areas don't break. So if you were to brush your teeth, for example, as long as you don't swallow your toothpaste, that, in essence, would actually invalidate the fast. But if you were to just brush your teeth, that would not invalidate the fast. Some scholars say caution should be presented because there's a risk that you may swallow. And for that reason, they advise that you should not use toothpaste and things like that, and so forth. So you may hear certain imams do that. Same thing with nasal drops. Nasal drops potentially can end up at the back of the throat. And for that reason, some scholars say no, nasal sprays and nasal drops, they would invalidate the fast because they end up at the back of the throat, and you can taste them and so forth. So they basically consider that it invalidates the fast. Inhalers, the same kind of point again. Now, the main thing to take from this is that when we look at inhalers, the main issue here is what some scholars do is they look at it from the perspective of the quantity of medicine. So it's solely about the quantity. So if it's a very negligible amount that is going down the esophagus, then that's acceptable. And what they do is they do an analogy, a qiyas, from the idea that when you use miswak, for example, then miswak, what you're doing is the contents of the miswak can mix in with your saliva, and you end up swallowing that without you being conscious of it. So clearly there is a negligible amount that's going down your throat, even when you use a miswak. For that reason, they say that a negligible amount is excused, and hence when you're using an inhaler, the negligible amount that goes down the throat into the esophagus, into this, that negligible amount is accepted and excused, and for that reason inhalers are permissible. There's a strong argument for those who say that it's not permissible. In other words, it invalidates the fast. And the analogy they tend to use is, for example, that number one, if you were to spray a salbutamol inhaler into the air, you will see there's a discernible body, a kind of a white sort of gaseous component that exits the inhaler. And when that deposits on the lining of the skin, lining of the mucosa, it actually becomes liquid, and there is a sizable amount that actually goes down the throat. They bring the analogy of smoking, for example. Everybody agrees that smoking will invalidate the fast, and if you were to smoke, there's a certain amount of that goes down your gullet, even though quite a lot of that goes into your chest, into the lungs, to the trachea. And they say that surely if you were to use inhalers, and you excuse that, then why don't you excuse the idea of smoking? So there is a big discussion. I'm not going to go into the details of that. But my advice is, for those of you who do use inhalers, and clearly if you're going with a school of thought, an idea or an imam who basically says that it doesn't invalidate your fast, that's fine. Those of you who do consider it does invalidate your fast, my recommendation is that you use the inhaler if you need to, and you continue fasting through the day. And what you do is you make up for that particular day that you missed or you use that inhaler in later on, and ideally in the winter months when the days are shorter. But continue fasting through the day, just use the inhaler as needed. Clearly, if you become unwell, then you would have to break your fast. That's a separate issue altogether. Okay, so there's something about toothpaste, mouthwash, which I talked about earlier on. Ear drops, there's no, as long as the eardrum is intact, that's fine. Eye drops, again, there's a difference of opinion. Majority say that eye drops do not break the fast. Okay, there's also sublingual medication that you place under the tongue, because that doesn't go directly into the qualified cavity, but rather it remains in just in the jawful manfaz al-muqtaba, which is basically the cavity that leads to the qualified cavity, and for that reason it doesn't invalidate the fast. Suppositories, anal suppositories, difference of opinion. Some say that it only rests around the anal area, goes into the rectum, and the rectal area is not considered as the cavity, and for that reason there's a difference. Some say that it's only a very small amount that would be absorbed at that point, and for that reason it's excusable. Majority do say that using suppositories do actually invalidate the fast. So I would highly recommend that, you know, out of caution, just avoid using anal suppositories. There's not normally that you need to use anal suppository during the day a number of times, but rather once a day is fine, and then you can do that during the time when you're not fasting. Vaginal urethral examination, pessaries pads, none of them invalidate the fast. That's unanimous. Urethral catheters, cystoscopies, none of them do. That's unanimous. Extracting blood and cupping, it does not invalidate the fast, because you're not bringing something into the body, you're extracting. Some say that it's makruh, that it's disliked for you to do that because it makes you weak, and as a result of that, there's a chance you may end up having to break your fast. For that reason, they say refrain, but it doesn't break your fast. Nutritional IV fluids, blood transfusion, I talked about that earlier on. Depending on the nutritional value, some say that nutritional value basically invalidates the fast. The same applies to hemodialysis. You'll find a group of scholars who basically highlight that, you know, even using blood transfusion does not invalidate the fast, because it's not a valid entry point. Generally speaking, my perspective on this is anybody who's having blood transfusions and IV fluids should not be fasting anyway. Okay, right. So just laying down a couple of questions related to hardship. I know
if I can interact there, we are very mindful of time, actually, because we got another webinar planned after this one, inshallah ta'ala. So if it's okay with you, can we call it a day?
Yes, that's fine. Alhamdulillah.
I mean, there are still some people who want to ask questions, and we got some raised hands. So if it's okay, we will take questions for next probably around 5 to 7 minutes, and then we'll close, inshallah. So Shahad, Sister Shahad, I'm unmuting you. You can ask the question now. So you have to unmute yourself and then speak. Okay, we'll move on. I think there's some trouble there. Sister Shahad, you want to try again?
Assalamu alaikum.
Walaikum salam.
Thank you for an excellent talk. That was really helpful. Jazakallah. Just wanted to clarify what you said about using an inhaler and fasting.
Yeah.
So did you say if someone uses an inhaler and they're fasting, it does invalidate their fast, and so they need to repeat their fast in the winter month? Is that correct?
Well, it really depends on who your local imam is, and there are two components here. One is about how the principles that are derived on the basis of this. Now, there are certain schools of thought that basically believe that if there's a negligible amount that goes down the throat into the stomach or into the esophagus even, because the esophagus is considered as a qualified cavity, you see. So if it goes into the gullet, if it's a negligible amount, then that's excused. So if you're using an inhaler, there's a negligible amount that goes down into the gullet, and hence is excused. So none of them deny that there is some medicine that goes into the gullet, the esophagus. Now, the issue there is that others don't accept that. They basically say that it's medication, it's discernible body, and this concept of negligible amount is not Yeah. And if you go to an imam who is saying to you that it will invalidate your fast, and you believe that that imam has the sufficient knowledge to inform you of that, then you make that decision that, okay, fair enough, it's going to invalidate my fast. My recommendation is that carry on using the inhaler, because you need to use that inhaler. What to do is continue to fast, continue using the inhaler, and just make up for the fast later on, ideally in a winter month.
My own concern with that is in the Quran, in Surah Al-Baqarah, it does specify what is forbidden when you're fasting, and the whole purpose of fasting is to learn self-restraint. And alhamdulillah, I feel that Islam is a very practical religion, and sometimes we make it more complicated. And I just think, as doctors with access to the Quran and some understanding, I mean, I personally would feel that is too much hardship for a patient to not only fast in the summer but then repeat the fast. I don't feel they're gaining the blessings of Ramadan. They're already self-restraining by not eating, not drinking, not doing the other things. And I think inhalers are not really anything that's going to take away from that. And that's my personal perspective. But I don't know, you know, I personally would say to a patient, I think you could use your inhaler. You could potentially repeat your fast, but actually I think Allah will just accept your fast and what you've done. So it just seems too much for me.
Well,
I think
in essence, I am saying exactly what you're saying. That basically you'll find that I get a lot of people who come to me about this. So clearly, I have many people with different severities of asthma. So on that basis, and a lot of them do come and they say that, you know, I've been told that the use of the inhaler is going to invalidate my fast. I say, basically, carry on fasting. You know, don't stop fasting. Carry on fasting. Abstain from food. Abstain from drink. But you need to use the inhaler because of your particular health. However, clearly the intention is there. The individual has basically had the intention of fasting through the day, and inshallah Allah will reward him immensely for just equivalent to anybody else. But he's been coerced in a kind of a way that he's basically out of his ill health. He's had to use an inhaler. But the idea is that we have to look at it from a very clearly Islamic ruling perspective. There's something about you know, the rulings and the reward, and there's something about principled rulings that the classical scholars have clearly outlined. So if something clearly is considered as invalidating your fast, which some consider inhalers do, you do have to make up for that fast. So that individual, even though they'll get the full reward of even if they are using an inhaler, they'll get an immense reward because they've abstained from food and liquids and so forth. They, from a Shari ruling, they would have to still make up for that fast if they are following that school of thought.
Jazakallah khair, Shaykh Rafaqat. We'll take one last question. I'm really mindful of the time. So Umar Sharif, you're unmuted now, so you can ask the question.
Yeah, thank you. Assalamu alaikum, Shaykh. My question is regarding the medication. What is the position with regards to opioid derivatives or major tranquilizers or hypnotics? How do we advise patients during Ramadan if intoxicant is a deterrent to break the fast? So if a patient takes it at suhoor time, and when the tranquilizers or the opioids reach their peaks during the time of the fast, how do we reconcile that?
Going back to that sort of rubric that I put to you, you would have to make a decision on that. But generally speaking, tranquilizers, as long as they are ones that are recommended by your doctor, are acceptable from an Islamic viewpoint anyway, regardless of what they are, as long as it's a recommended evidence-based thing and it's effective. That's acceptable. Now, whether it actually makes somebody very weak, and you're right, so let's say, for example, somebody's taking long-acting tramadol, or even morphine, at suhoor time to relieve that pain through the day. You need to measure up and make that decision that when this individual, through the day, they are to take this particular medication, they will become very weak, and as a result of that, there's inevitable that they would actually probably have to break their fast because of it. Then you can advise that to the patient that, it's probably recommended because of the severity of your pain. These drugs are probably going to make you feel quite weak, and you need to take those drugs because they're important. Otherwise, you're not going to be able to perform. Then that's an excusable concept. Just I'm just going to relate to this, and I know this is the last question. I'm just going to relate to this, going back to that issue of hardship. Something which is very, very clear in the Sharia, and I'm going to emphasize this very importantly, because at the end of the day, I don't use my own logic, because my logic is not always correct depending on my circumstances. So I have to go by principles. Okay, I'm putting very clear principles to you. I'm not using emotion either. And the very important thing about those individuals who are undergoing hardship and they're fasting, it's very important that the Sharia stipulates that they must fast. Okay, and during the time that they are fasting, so let's say we go to the issue regarding somebody's doing their GCSEs, a surgeon who is operating through the day, that individual has to make an intention of fasting. He has to go about and fast. If during the time of fast he feels that he has become weak and basically unable to focus, and as a result of that, that's now becoming detrimental to them, as a surgeon, at that point can he make a decision not or to break the fast. Not the fact that even before he begins the fast, he's already made an open decision that he's not going to fast. I'm not going to fast for these few days. It's my GCSEs. That is not acceptable. I'm sorry, but it's not acceptable. If a child is going through their GCSEs, or a surgeon who's basically operating, they have to start fasting. Okay, through the day, if they basically see that this is going to have implications for me now, and the only way that I can resolve that is I need to take some fluids, or I need to have something to eat, or take some sugar or something, okay, then it's excusable out of hardship. Now, I had a couple of slides that I wanted to go over, but we don't have the time. But it's very important for you to understand that. وَمَا عَلَيْنَا إِلَّا الْبَلَاغُ. Okay, my role is solely to inform you of what the Sharia says. Whether you accept that or not is entirely something that you need to take, and that's, you know, something for you to accept or not is down to you. But these are things that are very clearly stipulated. Okay, so even if you're a surgeon operating through the full day, the first thing that is required of you is that you should ensure that your surgery list should not be happening in the Ramadan. You should ideally be taking annual leave during that time. So you need to change your timetable a bit. Okay, and even if that instance is such that it's not possible for you to do that, then you must still fast. Or if you're taking GCSEs, you still must fast. And then during that period where you see that clearly it's going to cause me issues, at that point it would be acceptable for you to break your fast. Okay, inshallah, I'll leave at that point. I accept that the time has run out. Jazakumullah khair. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. السلام عليكم ورحمة الله وبركاته.
وعليكم السلام ورحمة الله وبركاته. Jazakallahu khair. May Allah bless you abundantly, Shaykh Dr. Rafaqat Rashid. I hope we all learned from today's webinar. I really enjoyed it. I really learned a lot from it. And inshallah, as Shaykh mentioned at the very beginning, it's a huge topic, and really to cover it within an hour and a half, it's impossible. But mashallah, Shaykh did a really good job on kind of giving us the basic principles of fiqh relating to fasting. So jazakallahu khair, and jazakallahu khair everybody for joining us for this live webinar. I would just like to mention, for the people who have signed up for the Healthy Ramadan Talk, you have to now log out from this webinar and log in using the second link that was sent to you. You were sent two links. One link was for Fiqh of Ramadan, Fiqh of Fasting, and then the second link was for Healthy Ramadan Talk. We will inshallah ta'ala begin that webinar in 5 minutes time from now, inshallah ta'ala. So jazakallahu khair. Assalamu alaikum wa rahmatullahi wa barakatuhu.